Welcome to the Ask the Expert Show with local celebrity host Steve-O. Sit back each week while Steve-O educates you with live in-studio experts, such as lawyers, doctors, home improvement, and financial experts in their field. Call in and have your questions answered each week at 888-565-1470. Now, here is Steve-O with today's expert in their field.
Well, you know what? You've asked for it. We've gotten so many emails, people asking us, do something on pain, do something on ED. We have gotten so many requests to bring in a show for pain, but we actually haven't had any openings for a while. But we finally got one, and not only did we get a practice that does pain, they do a lot of different things that you're going to find out today, and it's going to be a really different show. Hey, if you would like, we're on 95.3 FM. If it's not coming clear on your AM, or on 1470 AM. And you can actually go to WWNN's website and watch today's show. So we have, I'm going to welcome, one of them is so nervous that she's going to find out this is so easy. We have two very fine doctors, Dr. Robert Hannah-Pohl. Did I say it right?
You said it perfectly.
Wow.
Yeah, that's unusual. Most people don't get it right.
I cheated.
I'm not a doctor.
I cheated. And we have Jessica Allen with us. And the first 30 minutes of the show, we are going to talk about you men. There are so many new things out there for ED. And we're going to talk about those things. And from what I understand, you don't have to do really the injections like you used to.
No, you don't.
No more blue pill?
Not if you don't want to.
Wow, this is going to be interesting. So, can I call you Rob?
Absolutely.
Rob's a senior partner of the business. Tell us about your wellness. It's called Active Wellness. Tell us, how long have you been in business for?
Okay, well, the name of the office is Active Life Wellness. That's the umbrella name. And it started out 23 years ago.
Wow.
In the same location on Sunrise Boulevard in Plantation, 8320 West Sunrise Boulevard. And the office started out primarily, very simply, as a chiropractic office.
So adjustments.
Adjustments, exactly. And through the years, the practice has really evolved into many different facets of the wellness movement, okay? Because people today are looking for alternative solutions to drugs, to surgery. I mean, every time you hear an advertisement for the pharmaceutical industry, what do you hear when somebody's running through the fields, holding hands, or eating ice cream cones together? All you hear is, well, taking this may cause nausea, vomiting, diarrhea, da, da,
yes.
da, da. You know, you may want to commit suicide. Okay, so, you know...
That's one of them, too. Suicide.
Yes, and suicidal thoughts, okay? So we really have taken a different approach to healthcare, where we really try to look for how to fix the causes of problems rather than just mask or treat symptoms. We look to treat the patient that's experiencing the symptoms rather than treating the symptoms. And unfortunately, most of healthcare really treats the effects rather than tries to correct the causes of problems.
Tell me what that means.
Well, what that means is that, for instance, most pharmaceuticals, most drugs, okay, are going to treat a symptom, all right? So somebody's experiencing, for instance, headaches, or let's, go right to erectile dysfunction, okay? Most drugs are going to treat the symptom, but not really look at the whole person. What's causing the symptom? Let's look at this person's stress levels. Now, stress, you have 3 different types of stress.
Everybody's different.
Well, everyone's different, okay? But you have chemical stress, you have emotional stress, you have physical stress. Chemical stresses would be the things like the foods that we eat, the air that we breathe, all the chemicals, preservatives, things like that. Then we have physical stress, sitting all day long, sedentary lifestyles, or too much physical work. And then we also have emotional stress, anger, resentment, people are in difficult relationships, trouble at work. This all affects the person as a whole. It affects their body, it affects their function, okay? So we look at their stress levels, we look at nutrition, we look at exercise.
How important is nutrition?
extremely important. Okay, and you know, that's what you're seeing right now. Look at all the, even, you know, all the different stores like Walgreens and all the different, you know, the drugstores. Everybody's really getting into, you know, homeopathic, and all you hear about is all the natural food products and all
Organic.
and organic, right? You see all the different organic food stores opening up. You know, I call my kids the organic kids. You know, my wife doesn't even shop at Publix anymore, okay? Because it's extremely important, and a lot of people, unfortunately, don't understand this. You know, really, unfortunately, I have a friend whose wife is suffering right now with a very, very life-threatening disease, and he just can't get through to her how important it is to change her diet and change her nutritional habits, because what she's doing is actually perpetuating the problem that she's having. So we're really trying to come up with a strategy
Who would ever
to help
thought
them
a
there.
chiropractor would need to know about nutrition? But you do, because
Well,
it plays such a big part.
Yeah, well, most people think that chiropractors are back doctors.
Yes.
Okay.
Automobile accidents.
Yeah, exactly. But that's not really how chiropractic started. Okay. You know, chiropractic really, you know, we utilize the spinal column as our portal of entry into the system. So, for instance, where the medical system utilizes, you know, the oral cavity or the skin, so they're either going to give you a shot or give you some kind of chemicals as a portal of entry into the system to affect a symptom or an effect of a cause. The chiropractor utilizes the spinal column as the portal of entry into the body to actually correct a problem, to reestablish the communication between the brain and the body and the brain, so that the body can function normally. For instance, if there was a power outage in this office, well, then obviously, you know, nothing's going to work in here. What happens is we get power outages in our bodies. And I'll just give you an example. Many times patients will come to our office, you know, they basically come in pain. People don't really understand this concept that I'm explaining to you right now. But basically, they'll come in pain, and I'll give you a perfect example, because many patients come with mid-back pain.
Right.
And after, you know, I'm treating them for, you know, a couple of visits, they'll say to me things like, you know, doc, since you've been treating my mid-back pain, you know, I don't have that stomach problem that I used to have before. I used to get a lot of heartburn and things like that. Is there any relationship there? So I show them on the charts that, yeah, you see this area that I'm actually fixing, you know, or correcting that vertebra that's slightly out of position, putting pressure on the nerves and interfering with the transmission of the impulses from your brain to the stomach and stomach to the brain. And what's happening is it's causing static. And that static is now not allowing your stomach to produce, you know, the right amount of acid and in the wrong quantities and at the wrong time. But now what's happening is you're not only feeling better, you're functioning better. And the same thing even happens with all kind of problems. You know, Jessica and I were talking about the ED, the erectile dysfunction problem. And what we're doing now with all of the patients is we're actually not only providing the GainsWave service, which we're going to talk about in a minute, but we've also really decided that these patients need to get checked, you know, chiropractically or neurologically, because there are nerves in the lower spine around L3, L4, L5. We just showed a patient these charts, and these nerves travel to the male organs. And if those nerves are being impinged or squeezed or interfered with at all, then it's not going to allow them to function normally, and that's part of the problem. So, you know, it's basically like, you know, if your foot is on a garden hose, the water's not going to get through. Okay, you take your foot off the hose, the water gets through, and everything works properly. Okay,
This just seems so much safer, too, than taking all the drugs and the, like you said, the skin, the injections.
well, all drugs, you know, have side effects, and so
A lot.
You know, you asked me about the
There is not one
practice.
that
So
doesn't.
the way that we've evolved the practice is to really have a mission to provide the public with services that are healing services, that are holistic services, that can help them with all different kind of problems, but without drugs or surgery.
Well, tell us now, before we get in any further, because we're talking about the practice, tell us all the services you provide.
Sure. Okay. So we have a few different divisions of the practice. Okay. We have the Active Life Wellness Division, which would be your chiropractic. We do see injuries and accidents. Okay. Then we have Active Life Laser Pain Center, which we'll get
gonna talk about
into in the next
second
half hour,
half.
which is the most incredible service that I've ever provided besides the GainsWave in the 23 years of practice. I mean, I've seen more.
That's saying a lot.
I have seen more miraculous results with laser than I have seen in 23 years of practice. Okay? And it's really incredible, and I'm completely passionate about it.
You couldn't tell, could you? And if you just tuned in, we're talking to the Active Life Wellness Center. We have both Dr. Robert Hannapol and we have Jessica Allen. Jessica's going in a few minutes is going to be talking about GainsWave, and so some of the other services you provide.
Okay, and then the next division of the practice is Active Life, Anti-Aging, and Regenerative Medicine. This is where healthcare is moving right now, and this is the umbrella which GainsWave, the erectile dysfunction treatment, is under. But we also do stem cell therapy. We do PRP, which is called...
I was talking to Jessica. Tell people, because people are hearing about stem cell. What is the success rate of stem cell?
It is extremely high, actually. We can use stem cells now to regrow hair. We can do them as a facelift to regenerate a whole face so you don't have to go into surgery.
Wait, did you say regrow hair?
Regrow-
Talking to a bald guy. no, did you say... But
You can regrow hair. What does it
From
takes
stem cell.
from stem cells? What happens is there are dormant cells, hair follicles that are in the head. What the stem cells will do will initiate them to start growing hair
Wakes
again.
them up.
Yes.
Wow.
So between stem cells, which also involve cytokines and some growth factors, it gets the
You
hair
showed me
growing
that
again.
picture.
Yes.
That was amazing.
Yes.
That was really amazing.
Yes.
Because you hear, I got to tell you, you hear both sides of stem cell, but, you know, I'm starting to hear more success stories.
Yes.
And I have never heard a failure. I've just heard people say, well, it's not mature enough yet.
It's
But
getting there.
Yes.
It's getting there,
So I'm glad
which
to
is
hear
wonderful.
good things.
We can use it as to help with facelifts. It'll help regenerate the collagen back in the skin again, so you have a more youthful look. We can use it for the erectile dysfunction. We can use it for injuries, for sports injuries and wounds.
It
to
works
help them
very
heal.
well along with the laser treatments also.
Yes. We use it concurrently with laser and helps heal injuries
Is it
and
a
wounds
long
faster.
process, stem cell?
Do you mean to do the
Do you have
process?
to come in a lot?
One time.
Wow.
Stem cells just need one time.
You heard that. Listen, one time. How often do you hear that? So, God, your practice is very diversified.
Extremely. Along with that, we can do the platelet-rich plasma, PRP. We use that for the erectile dysfunction also. That normally takes 3 sessions, one a month for 3 months. But
I
ultimately,
can't
it does a
wait to
great
hear
job.
about GainsWave because I've actually heard about it
Yes.
when I was traveling around the country. And when you said that you now do GainsWave, I went, God, it's here in town now.
Oh, yeah.
This is very big. We're going to... So, I guess let's jump into it. We've got to go to a commercial first. And when we come back, we're going to talk about ED GainsWave.
Active Life Wellness has helped thousands regain their health since opening their office in 1995. Every year, their passion for health and wellness grows as they continue to help many who thought they had to just live with the pain or settle for less than optimal health. At Active Life Wellness, the team is ready to help you get healthy in a variety of ways, which include our 2 areas of focus today. First, we dive right into the subject of men's sexual wellness and how using the revolutionary GainsWave technology and protocol can be a lasting solution to those suffering from erectile dysfunction. Next, we'll talk about how non-surgical and drug-free high-power deep tissue laser therapy can effectively treat your pains and regenerate your injured tissues at the same time. So, if you are ready to leave your pain in the past or regain your confidence and performance in the bedroom, contact Active Life Wellness Practice today and let them show you how they can improve your life forever. Call them today at 954-423-0020 or go to their website at activelifewellness.com.
Hey, we are back with our new sponsor, Active Life Wellness. We have Dr. Robert Hannapol and we have Jessica Allen. Now, it's called a nurse practitioner.
Correct.
Tell me what that means.
It is the advanced nursing. It is 8 years of education with a master's degree. And my specialties are critical care, emergency medicine. And now I am also a nurse anesthetist, and my specialty at the present time is anesthesia.
Yes.
Yes.
Wow. So how new is Gaines Wave?
It has been in Europe for approximately 18 years. It has only recently come over to this country in the last 2 years. So
Okay.
it's fairly new in this area.
So what causes ED?
Okay, well, ED, erectile dysfunction, it's the inability to achieve and maintain an erection firm enough to achieve a penetration and to satisfactorily complete the act of intercourse.
But you hear things like people with high blood pressure. There's certain things that people have that causes them this type of
Yes.
dysfunction. What are those?
You have high blood pressure, you have obesity, you have smoking and alcohol, cardiovascular disease. And you
What about watching cartoons late at night?
depends which ones.
How about hormonal?
Well, that's another section of it, is usually low hormones like low testosterone. Another hormone is low pregnenolone, DHEA. You have to watch cortisol. You have to look at all the hormones in general. And if they're low, you're going to have a sexual dysfunction also.
So I come in to see you. Is it when you first sit down? First of all, can people come in and you discuss it? What Gaines Wave can do, or do you just go right? I mean, it would seem like you have to sit down with them and kind of do a history and physical on them first.
I talk to them. I start with talking to them. What's going on? What are your problems? How long have you been having these problems? What do you find causes the problems to become worse? Things like that.
Okay, so a patient comes in, says, "I want to get started." What's the next step?
How long have you been having the problem for? When did you start noticing it? Have you had any changes in your health status? Have you increased or doing smoking? Have you gained a lot of weight? Do you have any heart disease or any high blood pressure problems? Do you have diabetes? They all
So
have the same
if
problem.
someone has heart disease, what does that mean?
Usually it means you have clogging of the arteries, decreased blood flow to many parts of the body, and you have the high blood pressure.
Can you help a person who's got heart condition, blood pressure problems, hormonal problems?
Hormonal problems, yes. If you have heart problems or heart conditions, I would suggest you see a cardiologist
Okay.
or your primary doctor.
Okay,
That way they
that's-
can do further testing to see if anything else is underlying that's causing more problems.
Tell us what Gaines Wave does.
Okay, what it does,
It's not an injection.
no, it is extracorporeal shockwave therapy.
Okay, it's on a pill.
No,
Wow, I'm
it's
liking
acoustic
this.
waves. And if anybody's ever heard of lithotripsy, which many people have had, where they take shock waves and push them into the kidneys, because when people have kidney stones, there's a lot of pain. They use shock wave to break up the kidney stones.
Wow.
This has the same idea. It puts shock wave onto the penile shaft and helps break up the clogging of the arteries. You have arteries and veins in the penile shaft also that usually have a lot of clogging.
Okay.
Or
so
scar
with the
tissue.
pill, you could take if you knew you were going to be having sex in
Right.
2 or 3, you could take a pill.
Yes.
And then they got it better that if you knew in an hour, you could do an injection. What does this do?
This is
Is
natural.
this something you do in the office?
Yes.
And the Gaines Wave, to that point, the Gaines Wave is on demand, meaning that
You don't have to wait for a
you don't
pill to
have to
start
take
working.
the pill. You don't
Okay.
have to. It basically can last. The results can last for up to 2 years.
This is natural.
What?
This is all natural, which is the nice part. You're being spontaneous with this. The results can last up to 2 years.
Not average, but even.
It can last up to 2 years.
Wow.
All we suggest is you come in every few months just to do a session, just to maintain the clearness of the arteries and the vessels. Because this will help to regrow and regenerate new cells, as well as make the cells that you have there more permeable to blood flow, so you can increase the blood flow into the cells to make the shaft hard.
Right. So
Wow.
it not only it breaks up the microplaquing, but it also stimulates a process called neovascularization or angiogenesis, meaning that the body then starts to create new blood vessels, new blood flow.
This is amazing.
It is.
I mean,
It
this
makes
is,
you back to where you were when you were younger.
wow. Okay, so we haven't rehearsed this at all.
No.
I don't rehearse things, and I just always like to ask questions at our listeners. So what's the success rate?
We have up to 75 to 80% success rate.
If you got that 80%, you're doing really well.
I have some amazing
Just call my
stories.
wife.
Yeah, but you're only 20 years old.
Well, there's 3 types of patients that come in.
Okay, so let's talk about that.
Well, okay, so we actually get phone calls all the time from guys in their 20s. And,
Okay, I
you'd
can
say,
understand that.
geez, why would a guy in their 20 call about erectile dysfunction? Because they don't really have dysfunction. These guys want to be total studs.
Right, no, that's what I thought.
They want to perform like,
This
Yeah.
will
You got
make you
it.
stronger,
All night.
harder,
right.
and it makes it work better.
And then the next type of patient that calls is the guy that may be a little bit older, that's doing just fine, but not like they used to be.
30s
Okay.
to 50s range.
Okay.
It's just not the way it used to be.
Guys, you better be writing this down, I'm telling you.
And the third type of patient is someone that really has a very, more of a severe condition. And Jessica has an amazing success story with that.
I had a gentleman.
Tell us the age first.
Okay, he actually was in his early 40s,
Okay.
and he had not been able to have an erection for well over 10 years at all. We did.
What was his problem?
He was obese,
Okay.
and he also had diabetes.
Oh, okay.
It was reasonably under control, but not extremely well. And I started doing sessions. You start off with 6 sessions at a time. With that, I did the PRP, the platelet-rich plasma injections. And by the sixth session, he's already starting to get hardness enough where he could actually penetrate for the first time with his wife that he had
Now,
not been
how
able
long,
to do.
6 sessions, what does that mean? Is that once in the office, then come in the next day, or
Normally, you start with 6 sessions.
At one time?
At one time. Well,
Okay.
twice a week for the first 3 weeks.
Okay.
In that, we will do the PRP, because that also helps regrow and regenerate new cells. The PRP, which is the platelet-rich plasma, helps, like I said, increase the cell growth. It takes your own plasma that has the cytokines and has growth factors, re-puts it back into the shaft, which in turn will help the body believe that it needs to regrow and reheal again. And that's what makes it harder
Okay.
and stronger
Do
again.
they, so you said come in every week?
Twice
and
a
have
week.
2 sessions? Or have-
Twice a week
Okay.
for the first 3 weeks.
Anything happen the first week
It can.
after 2 sessions?
It can. If
Okay.
you are having only some difficulty but not complete difficulty, you can see changes within the first session.
Because we don't want someone to get discouraged.
I warn them that they may not.
Actually, Men's Health magazine did a great article on this, and it's on our website at www.activelifeantiaging.com, and just click on Gainswave because the article is incredible. One of the staff writers of Men's Health magazine actually went for the treatment to write about it. And when you read the article, he has an amazing result at the end of the article, okay, with one treatment. Okay, I don't know if
we
any-
realize everybody's body is different. So
Right.
it cannot
Exactly.
even begin to work
It will not work the
as
same for
fast or
everybody.
right.
And depends how much of a problem they've had and for how long. Many
So
times
I can hear our listeners right now going, okay, how painful is it?
it is not at all. If you're always concerned about it, we also use a numbing cream that I put on beforehand, just in case.
Okay.
But no one has ever complained of any discomfort with the
But it's
sessions.
not an injection? Is that
The
right?
PRP is,
Okay.
but the shockwave therapy is not.
That's the main thing. Really
That is
the-
the big thing, yes.
Okay.
It's on a very low intensity, because I know that we mentioned that this was used for the same technology as kidney stones, but a much
lower.
lower intensity.
Now, the injection, do they take home with them? Does this
No.
need to be done in conjunction with?
I do the shots in the office.
Okay.
I do it myself.
Okay.
Because we're going to draw your blood. We're going to spin it through a centrifuge, separate the plasma from the red blood cells. The plasma itself is what has the growth factors. And that's what I will re-inject back into the shaft of the penis.
Well, I know men right now are wondering, so who is not a candidate? I mean, what if a person has high blood pressure?
The person who is not a candidate is somebody with active prostate cancer
Okay.
or penile implants.
Okay.
That's really it.
If you have implants, why would you need this though? Anyway, right?
Right.
But but you're saying somebody? Well, you just said who is obese.
Mm-hmm.
It's okay.
Yes.
High blood pressure. Okay.
Yes.
Well, because we address all those issues also. All right, so we have a weight loss program in the office. We work with them on nutrition to help, with their overall health and well-being. So we're going to address the whole person,
Correct.
not just the body parts.
And we help
Okay.
with homeopathic medicines if we need to for the diabetics to help try and control the sugar levels to
I
bring them
bet
back
you
down
guys
to
have
normal.
great supplements. Wow.
Well, we do, and again, as part of the offer, what we're going to do, Jessica, is you said that we were going to give what % off on the first treatment,
I will give off 25%
on the whole treatment, right?
for all 6 sessions.
Wow.
For somebody who mentions that they heard us on this station.
Okay.
And you know
So-
what? And we're going to up the ante a little bit, okay? We also use a supplement called Men's Bioidentical Support, which is an amazing supplement to help the body to produce more testosterone.
My
Okay.
patients can't
Very
get enough of
They
important.
it.
can't get enough of it. It's going off the
Supplement?
shelves. So what we're going to do is we're
Yes.
also going to provide that for anyone that mentions this radio station, 1470 AM or 95.3
Ask the Expert
FM.
Show.
Ask the Expert Show. We're going to give them 50% off on the supplement.
Wow. Now listen, I know about taking testosterone. It's not cheap at all. So
Right.
that's a nice little offer you're making.
And the great thing
Yes.
is that this is not testosterone. Now, some of the patients are prescribed testosterone, but what
this what stimulates?
Exactly. What this does is it actually helps the body to produce more testosterone on its own.
Now, we do also, with the 6 sessions and the PRP, we do complementary lab work. So that way we can see what your testosterone is, what your levels are, and all the other hormones, as well as some of the basic lab work, to get an overall picture of how healthy or not healthy that you are. That is complimentary. I
is
don't charge
amazing.
for that.
Because we have,
As
in one
part
of
of
our
this.
other markets, we have they use me for the guinea pig. First of all, it's no fun taking shots every day, and in your stomach. This is so much easier.
Yes.
And because it's going after the same thing. And I'll bet you it was not near as expensive. So I like this better.
Good.
This is amazing. I mean, it's almost like, we've gone from, the blue pill to the injections, and now we've gone
Going back
here.
to natural again.
Yeah.
It's all about helping the body to
the
work
fact that
better.
it could last up to 2 years.
And all you need to do is maintenance every few months, one time, just to make sure that everything is staying clear. And that's it.
Most people take better care of their possessions, their cars, than they do their own bodies.
Right. They'd rather spend the money on
before we go to
furniture.
break, let me just see if I can. So let's say
Yes.
someone's going to a bingo game, and they all of a sudden, here's Mildred. I wasn't expecting Mildred, but here's Mildred playing bingo. Oh, I'm out of medication. You don't have that with what you do you?
Not at all. You can be
That's
spontaneous.
Guys, are you hearing
Like
this?
you're in your 20s again. You're spontaneous. with
On
it.
demand.
This is really is
As
this
you
is
want.
something really
And it
really
changes the mental attitude of the men also because they realize they can do it again. They don't need help, which makes it so much more exciting. for them.
It's a breakthrough technology. It really is.
amazing. God, you just got all these little departments within a big conglomerate. That I love what you guys are doing. And I'm going to tell
Yes.
you, we're going to go to break. We got to go to break, but I got to tell you. So I'm giving notes. And when I can do a show and not even look down at the notes, that's a good show. And I haven't looked, I'm still on page 1. So I love what and you're going to stay with us because you're
Yes.
part of the group here.
Yes.
And we're going to talk about pain next. Let's go to break. If you'd like to give us a call here talking about pain, the phone number is 888-565-1470. We'll be right back.
Active Life Wellness has helped thousands regain their health since opening their office in 1995. Every year, their passion for health and wellness grows as they continue to help many who thought they had to just live with the pain or settle for less than optimal health. At Active Life Wellness, the team is ready to help you get healthy in a variety of ways, which include our 2 areas of focus today. First, we dive right into the subject of men's sexual wellness and how using the revolutionary GainsWave technology and protocol can be a lasting solution to those suffering from erectile dysfunction. Next, we'll talk about how non-surgical and drug-free high-power deep tissue laser therapy can effectively treat your pains and regenerate your injured tissues at the same time. So, if you are ready to leave your pain in the past or regain your confidence and performance in the bedroom, contact Active Life Wellness Practice today and let them show you how they can improve your life forever. Call them today at 954-423-0020 or go to their website at activelifewellness.com.
I'm gonna think of. Hey, we're back here. This is the Ask the Experts radio show. We're with you every Thursday from 5 to 6, and we hope we get your ride home. And we want to educate you, whether it's legal, health, financial, or home improvement. Today is our health day. We are here with the Active Life Wellness Center, which is in Plantation. You know what? There's might be other people who do some of the same things you do, but I always tell people, listen, if you have to travel an extra couple miles or something to go to the best, it's worth it. This is not where you want to look at who's got the best prices or who's the closest. That's not what they're about. So you asked for pain.
Well, on that note, I just wanted to say that we actually have patients that have come to us from other countries. We have an active patient right now from the Bahamas.
Wow.
We have a patient that we're going to discuss the laser. I know that, but a patient that has come to us from Jamaica. Patients that come to us from North Florida, from the west coast of Florida. They come from all over because people want to go somewhere where they really feel there's an expertise.
And they trust the people who take care of them.
Well, you're like ahead of everybody else, too. That helps, too.
You need to trust your providers.
Yes.
And sometimes that is very difficult to find people that can be warm and caring at the same time.
Well, I got to tell you something, because I don't know if a patient would tell you this, but you make it so easy to understand. I haven't felt like you've talked over my head. I mean, I totally understand everything you're saying.
Right.
And I think that's one of the most important things, because people come out of the doctor and go, he told me what's wrong with me, but I was afraid to ask.
Show you
I don't
care.
want to sound stupid.
Just show you care.
You shouldn't have to do that.
That's all it is.
So we're going to start talking about pain with Dr. Robert Hannapole. And it used to be just auto accidents, right? Mostly auto accidents.
Not
low
really.
back pain. This is 25, 30 years ago.
A lot of people
Your industry has
associate,
changed.
well, they associate, let's just say, chiropractic with auto accidents because you hear a lot of radio commercials. You see
But
a
it's
lot
not
of buses.
chiropractic anymore.
Well, what we're going to talk about now is laser therapy, which is not. I actually met with a guru, quote unquote, in the laser industry today. That's done a lot of research. He's an engineer. His background is unbelievable. But the lasers are being used in medical offices. As a matter of fact, there's a couple offices in California that are using the laser for post-traumatic stress disorder, so not pain. There's a lot of medical offices that are using laser. There's a lot of physical therapy using laser. Chiropractic uses laser, but it's not a chiropractic technique. That's why it's another division of our office.
Well,
It's
you're
actually called
doing healing tissue.
absolutely.
We use it
So
with the
that
PRP and the
is-
stem cells and with the ED also.
Yeah, that is
We all use
just...
it
Yeah,
together.
the laser basically gets rid of pain, swelling, and inflammation, and at the same time regenerates damaged tissue.
Goes back to this.
So this is laser now.
Right. This is high-powered deep tissue laser therapy.
Okay, because my first question here, and I keep reading, going, am I reading this right? About the laser treatments for eyes, for like LASIK?
No. Okay, so most people are familiar with laser
That's what they're
treatment for
familiar
eyes,
with.
exactly,
Yes.
for LASIK or
Is this the same thing?
no.
No.
Laser
That is painless.
Yeah. They're familiar with laser cosmetic procedures, laser surgery, because, most lasers have been designed to cut tissue or cauterize tissue, basically to destroy tissue,
Hair
okay?
removal.
You have the Laser Spine Institute, okay? I mean, that's a surgical procedure,
Right.
all right? What we do is we actually use wavelengths and power that heals tissue.
Okay. Is this it's called radio wave? Is that
No, this is laser.
actual laser?
Actual laser, right. There's certain wavelengths that are very healing to the body. So we use wavelengths that are within that window that actually cause a process called photobiostimulation, or the newer term is photobiomodulation. Okay? And what happens is the laser penetrates very deep into the tissue.
Painful?
Not at all.
No.
Okay.
The patient will feel just a soothing warmth. Okay? And when it penetrates, the photons of light actually get absorbed by what I don't want to get over the head, but basically what are called chromophores of the cells.
Okay.
Okay, so sick, damaged, or injured cells aren't functioning properly.
What areas of the body are we talking about?
Any type of pain in the body. So whether
Headaches?
well, we can use it for headaches,
Okay.
yes, if they're what's called cervicogenic or caused, from the cervical spine.
Shoulder?
Absolutely. Rotator cuff injuries, knee injuries. One of the largest amount of patients that are coming in is for plantar fasciitis, the foot pain. We get a lot of sciatica patients coming in, and disc injuries, tennis elbow, golfer's elbow, all kinds of musculoskeletal and neuromusculoskeletal complaints, and even neuropathies. I have a miraculous case with diabetic neuropathy that will blow
We
your
have
mind.
That exact person who runs all the production here. That's exactly what he has.
Well, I have
And
an
we'll talk to
unbelievable
him
case
That's common.
unbelievable case that I'll tell you about. But basically, what happens is the chromophores uptake laser energy, and we all took biology class. Remember the terms mitochondria, and the mitochondria produce energy. So it basically speeds up cellular metabolism, and it gets those cells that aren't functioning properly to start functioning optimally. And the laser therapy, if it's for 15 or 20 minutes, will last up to 18 to 24 hours, okay? And then the cells, may go back to where they were, and we do it again. And over time, they heal and they function normally.
Wow. I got to tell you, I'm going to surprise you now, because we've been promoting this show all week this week. We actually got 2 people on Twitter that had said they had a question. And I don't know. I mean, you'll be able to answer this. And there was both about knees.
Mm-hmm.
One person said, I have got meniscus problems.
Mm-hmm.
They want to operate. Well, you
Okay.
hear that all the time.
Right.
And there's some things that you do that you can keep people from having surgery.
Absolutely. Well, that's our goal, okay? Our goal is to help patients avoid drugs and surgery, okay? Now,
So
listen.
can the laser help this
Absolutely. Okay.
Wow.
Along
Now
with
there's
stem cells and PRP.
Okay.
Also.
yeah,
better than surgery.
Sometimes they need that, and sometimes they don't. Okay. When we have the very tough cases, then we'll add the stem cell PRP. Some cases don't need that. All right. So it all depends upon how the patient's progressing. Okay. But we see a lot of knee and meniscus problems, and I'll give you one example of a patient. She came all the way to us from Jamaica, specifically for the treatment.
The laser?
Yeah. She saw the website. Her son brought her in, and she had knee pain. She had a lot of meniscus damage, and she also had a lot of osteoarthritis, and was supposed to have a knee replacement surgery.
Please, you're not going to tell me.
Well, I'm going to tell you. Okay? I'm going to tell you.
Yes.
Because she wrote me a letter after we were concluded her treatment.
How many treatments?
She had 12 treatments.
Okay.
Okay? She said, when I first came to your office, I was walking on crutches. Then I progressed to a cane. Now I'm walking unassisted, and I was able to cancel my knee replacement surgery.
Wow.
It was, miraculous.
Wow.
Unless you can
And
do
those are the kind of results that we're getting. Now, not every case is like
no, I
that.
understand that.
And, listen, there is a need, obviously, for drugs and surgery. We're not saying there's not. But I believe there's a much smaller window. A lot of people will opt for drugs and surgery first and then seek us out, where we say, try more natural, more non-invasive methods first, and then you could always have drugs and surgery, but do that last.
How many people have you talked to that said they had back surgery
A lot.
and their back was worse after the surgery?
Yeah.
Countless.
So this
Well,
is
we get a lot of
something-
those patients. I get a lot of. There's actually a diagnostic code, a CPT code, for failed back surgery syndrome. How about that?
Wow.
So we get a lot of those patients coming in.
So arthritis really going back to the knee.
Mm-hmm.
Arthritis really, almost guts out your knee, doesn't it?
Well, look, a lot of patients will have bone on bone, whether it's
Bone on bone.
whether it's the
Cartilage
knee,
there in between.
whether it's in the shoulder, whether it's in the spine.
From arthritis.
I've seen the worst of the worst. But you know what I've noticed over the years, and this just comes with experience, is that a lot of these patients that come in with the bone on bone, many of them don't have a lot of pain. And then I have patients that come in and they have beautiful x-rays and they're incapacitated. So what I've seen over the years is there's more to the story, okay? And I've seen this with the discs also of the spine, you know, where someone will have a small bulging disc and they're in tremendous pain, and somebody will have the largest disc herniation and they're playing tennis, okay? So there's other things that go on. And it's not just mechanical, and it's not just the hard tissue. A lot of it is soft tissue, like muscles, ligaments, tendons, and a real culprit is scar tissue and adhesions. And what the laser does is it addresses a lot of these soft tissue issues and also softens up the scar tissue and helps the areas to heal. The scar tissue is weaker, it's more pain sensitive, and less elastic. So once you address that, many of the patients get well.
What kind of success rate do you have with knees?
Very good success rate.
Really?
Well, just like the story I just told you, okay?
Well, so I got to tell you, I'll tell you what I attribute it to, and you tell me how close I am. My knees are gone. I mean, they are gone. And I really, because I always walked on the hard cement. And you don't realize when you're walking, you're pounding on those knees. Mm-hmm. You're looking to see how long you can go for, you know, and you don't think you're doing. I really attribute the arthritis is to all the walking, even though it was great for me. But your knees can't take that much pounding every day, 30,
Absolutely.
45 minutes.
There is wear and tear, okay? But there also are technologies today and treatments that actually help to reverse. Again, what we call it is active life, anti-aging, and regenerative medicine. It's regenerative. The body is always trying to be healthy. It's always trying to regenerate. So what we do is we just provide treatments that help the body along. Now, you do have limitations of matter.
Sure.
Sometimes, you know, again, it doesn't happen and the patient will need to take the other route. But why not try
Why not? Why
this
do the
first?
Try the
surgery
safest
first?
thing first.
Exactly.
Well, because I agree with you 100%, because if you can get away from the knife and something that's going to help you, you're so much better
Well,
off.
you're not guaranteed with surgery.
That's
okay?
true.
And you're,
No,
and you're,
you hear
taking,
about
and you're
all the-
taking a risk.
Exactly.
Okay? Anytime you go under the knife, you're taking a risk.
Doctors, we're not telling people not, our MDs, our surgeons out there, we're not telling people not to have the surgery, but we're saying
It's a business.
try this alternative first.
Right. Try the least invasive methods
Exactly.
first. Absolutely.
It is a business, don't forget, like anything else. And what I've heard is somewhere about 25 to 30% of the patients get better. And that's it.
With what?
With back surgeries.
Yeah, well, I heard a little higher. I thought it was about a 50% success rate. But you know what? If
That's
somebody
good.
told me
Not from what I
if
see.
I went for surgery and it was a 50% success rate, I would try everything else
I would
first.
too.
And I can't tell you, we have a large percentage of patients that come into our office that have had surgery and they're still in a lot of pain, and now they're looking
Can you
for
still
something
help
else.
them?
We see patients with laser all the time that have had surgery already.
Okay, we're going to go to our last break. here's another one. I haven't even gone to my sheet. I've got so many questions. This is such an incredible topic because I know a lot of our people are suffering from some type of pain. This comes with age. We're going to go to break. We'll be right back with Dr. Robert Hannapol and Jessica Allen.
Active Life Wellness has helped thousands regain their health since opening their office in 1995. Every year, their passion for health and wellness grows as they continue to help many who thought they had to just live with the pain or settle for less than optimal health. At Active Life Wellness, the team is ready to help you get healthy in a variety of ways, which include our 2 areas of focus today. First, we dive right into the subject of men's sexual wellness and how using the revolutionary GainsWave technology and protocol can be a lasting solution to those suffering from erectile dysfunction. Next, we'll talk about how non-surgical and drug-free high-power deep tissue laser therapy can effectively treat your pains and regenerate your injured tissues at the same time. So, if you are ready to leave your pain in the past or regain your confidence and performance in the bedroom, contact Active Life Wellness Practice today and let them show you how they can improve your life forever. Call them today at 954-423-0020 or go to their website at activelifewellness.com.
Yes, we are back here. This is Ask the Experts. I'm Steve O. We're here with Dr. Robert Hannapole and Jessica Allen. She's a nurse practitioner. So
And
you've got me so excited. I mean, with both areas of your practice, but what does insurance cover? Did I ask a bad question?
Insurance is a very interesting issue, okay?
Yes.
Because a lot of patients think that they have insurance, and they really don't, for a lot of things, okay? Many people today have catastrophic coverage, which means that they're going to have a huge, $3,000, $4,000, $5,000 deductible.
Right.
They think they have insurance, they really don't. Or people have insurance, but they have very large co-pays, co-insurance. For these services, these are private pay.
Okay.
But we make it very, very easy for patients. We use different financing options. We use care credit, things like that. We stretch the payments out, and our prices are affordable.
Okay.
We want people to get healthy.
Right.
That's really the bottom line to this. We will work with you as much as possible.
Does insurance not cover this?
Because insurance is...
surgery is so much more expensive.
Yeah, it's
Yes.
backwards.
It doesn't make sense.
Things need to change. I had a conversation today, and I said, it's unfortunate because we should get paid to keep people well, and we should get paid when our patients are well. When patients fall ill or have issues, then we shouldn't get paid because we didn't do our job.
So that's the incentive.
Okay.
You want to
Yes.
get paid, keep them well, which means the insurance company doesn't have to dole out a lot of money.
Right,
Which
and the
they
insurance
do.
companies really, again, they don't cover a lot of services, and look at these bills people get from the hospital. They got a couple aspirin and they're getting huge
$800
bills.
for that.
Yeah, right.
Whatever.
But isn't that frustrating because you know how the success rate is? You know that this is important, just as important, maybe sometimes more, if you can save somebody from having surgery, but the insurance
But
company's
you know
not
what?
covered.
With the results and the type of technology that we have and how well we're treating our patients, it's not really an issue. When they see and they know that they have hope and that we can help them, it really hasn't been a big issue because we also give them many financing options.
I know many people ask me as far as the GainsWave, does insurance cover it? And I say, unfortunately, not.
I
They're willing
wouldn't
to
think it
cover
would.
all kinds of money for the little blue pill,
Right.
but they're not willing to cover for something like this that would actually heal them.
Somebody's in cahoots with somebody.
That's a whole other show.
Yeah, really. And listen, the people here from Active Life Wellness is going to be back next month. We'll have different topics we're going to be talking about. I got to tell you, I could just sit here and talk about this all day long because, and then on the pain part, which we're kind of talking about now, it seems like the older you get, the more places you never even would even think you would get pain from,
getting.
and you do. And it's just part of life.
Yes.
Yeah, it is part of life, but that again is we're learning a lot more today about what causes all these issues. And that's why, again, you have to focus on nutrition and exercise and rest and rejuvenation and emotional well-being and anti-aging and regenerative medicine. The field is really, blowing up. It's getting so large because we're learning that if we just take, proper precautions and we do the right things, then we really have a much better quality of life in our later years, much better than we used to.
I'm going to get into an area that is a little bit different than we're talking about, but we have a lot of females out there who are listening today. What kind of services do you offer females?
Well, obviously, we don't offer the GainsWave to females.
Yes.
However, I have to clarify that.
But they're getting their own pill.
Exactly. Well,
Yes.
but what's happening is we're getting a lot of females calling for their partners.
Okay.
Okay, because it
Yes.
is helping them. Okay, so for instance, if they're having, trouble in the bedroom with their
Wives will
significant
call,
other.
make appointments
The
for their
wives,
husbands. Wow.
the girlfriends are calling, so we're helping the couples.
Yes.
Yes, because I know that there's like when it comes to hormones, women also have problems too. Do you get into that hormone areas?
We do, mostly with the men right now.
Okay.
That's our focus. That may be something that we get into in the future.
I don't
But
want to leave
now-
the women out.
Yeah, right. Well, right now, we're focusing on on the
On the
gains
men's
wave, on the men's side, but that may be something that we move
the
into.
future.
What about stem cell, like for hair for women?
Absolutely. I've done stem cells and PRP both for women that have had hair loss.
Because I never knew women would lose their hair too. And
Same thing,
You
still
see some
hormonal.
bald spots.
Absolutely.
And if anyone
And
out
for the
there
facelifts.
has heard about the Kardashians, okay, they made famous
The
the
facelift.
vampire facelift. And
Bam. Okay.
what we do is it's actually using PRP or platelet-rich plasma, and Jessica performs that procedure, and the platelet-rich plasma is injected back into the face to help regenerate tissue.
Well, now, we've had this book sitting here. It's called The Pain Blasters. Interesting. Your name's on here, Doctor.
Yes, absolutely.
So, just tell me a little bit about the book.
Okay.
First of all, how can people get this?
Again, you can get it on Amazon.com.
Okay.
Okay, the book is it's nationally published. It actually hit best-selling status.
I see that.
Yeah, and
Internationally.
And basically, the reason why we put the book together was because the laser has just become such a passion because of all the results that we're getting, and we just want to get the word out there and have people really understand. Because again, a lot of people think lasers are really more for, again, like LASIK eye surgery and other kind of surgeries and things like that. And we're really showing them that we can treat pain with lasers. Not only pain, we've actually had a lot of success with neuropathy, diabetic neuropathy, and we've had one really incredible case that sticks out to me. If you don't mind, I'd like to talk about it.
We got about 3 minutes.
Okay, so I had a nurse come in the office that actually walked in our office with tears in her eyes. She was crying. I never had anybody walk in my office crying, and thank God,
From the pain.
never had anybody leave the office crying. That's even better. Okay, but she walked in the office crying, and not from the pain. No, she was just told by her physician that she had to have 2 toes amputated.
And if you're
Wow.
a nurse, you just can't work anymore because you're on your feet all the
She
time.
was so upset because she had
Diabetes?
diabetic ulcers on 2 toes, and she was so distraught because she says, I can't believe they're actually going to have to remove my body parts.
Yeah.
So she said, do you think laser, because I know it's regenerative, could it help? So I took a deep breath. I ran in the back of the office and wiped my face off with a sweat because that's a very tall task. I mean,
Yeah.
the laser's amazing for the pain, the knees, the shoulders, the elbows, but I never had to help somebody not have an amputation. Okay, so I said to her, look, I said, I don't want to give you. I want to manage your expectations. Okay, I don't want to give you any false hope, but I don't want to take your hope away. All right, it's possible it can help, but I can't give you any guarantees or claims. But if you're willing to try it, I'm willing to try, and let's just see how it goes. So we both noticed that after her first treatment, she came back a day or 2 later, and the actual ulcers looked different. They had a little shine or sheen over them, almost like the thinnest layer of saran wrap. So, and we both noticed the same thing. So we knew that the tissue was changing, okay?
Granulating.
It was exactly. Granulation tissue. So it was starting to heal. It was very interesting. Literally 8 or 9 treatments later, completely healed.
Amazing.
Completely healed. She did not have to have
You're
the
amazed?
amputation. I'm still amazed. And her husband has become a great friend of mine. We actually went out to dinner 2 weeks ago, and everybody he meets when he's with
People
me,
have been buying.
he tells the story. Yes, he tells the story to everybody. But what we do, and I know Jessica feels the same way, is just so gratifying. We're really living our purpose and our passion. We're not doing this for the money. I mean, look, we have to make livings,
Of course.
but the money should always be a byproduct of service. And we really provide an amazing service to people. And, I go home at night, and my wife actually always says to me, she's like, I don't want to hear another laser story. I don't want to hear another Gainswave story. But, you know, I don't want to retire. I could do this for the rest
Forever.
of my life.
Wow.
Okay? Because this is really a purpose.
This
We're
doesn't
helping
work
people.
anymore.
Yeah.
Well, told you, it goes by fast.
Yes.
Our hour is over here with the Active Life Wellness. I can't wait to see what we're going to talk about next month. Give everybody your phone number.
Sure. 954-423-0020. And if you call and mention the radio station 1470 AM and 95.3 FM, Ask the Experts, we're going to give you a 25% discount on the GainsWave treatment. And for the laser, what we're going to do is provide a complimentary consultation, and we're going to do a sample treatment, so you're going to get the first treatment for free.
That's amazing. You guys did great for the first show.
Thank you.
I can't wait to come back again next month. We'll be back, though, with you next week with more Ask the Experts. Everybody have a great weekend.
Thanks for tuning in today to the Ask the Experts show. Tune in while some of the top local experts in their field from Broward and Palm Beach counties educate you in the areas of law, health, financial, and home improvement. You can also call our offices at 888-574-6999 to become an expert on our show. The opinions expressed on the preceding sponsored program were strictly those of